Dear friends, welcome to YouTube channel, and on YouTube the name of this channel is Dr. Vet, DRVET. Just type DRVET in search bar, press the search button, you will get many videos. In this video I will tell you something about diseases due to deficiency of copper. I am Dr. P.R. Patel. In this lecture, we will study etiology, clinical manifestation, diagnosis, and the treatment of deficiency of copper disease. Copper plays a very important role in various enzymatic processes of the body and tissue oxidation. The deficiency of copper produces variety of clinical signs. The main etiologies are primary copper deficiency, when the copper in the diet is inadequate, when the forage or grass is deficient in copper. If there is copper deficiency in soil, the plants grown on such soil is also deficient. When animal graze such pasture or grass which is deficient in copper, animal suffers from copper deficiency. Milk is always a poor source of copper. So don't raise animals only on milk, give other food also. The secondary copper deficiency occur when the dietary intake of copper is sufficient, but due to some disease in the body, the absorption or utilization of copper by tissue is impeded. When there is high molybdate and sulfate intake, there is copper deficiency. We have seen that copper is important part of the enzymatic processes and helpful in tissue oxidation. Deficiency leads to variety of clinical manifestations. One important thing here is anemia, and characteristic anemia here is a microcytic hypochromic anemia. You know that copper is very essential for the synthesis of hemoglobin with iron. So deficiency leads to anemia. In deficiency of copper, there is hemolytic anemia, and it leads to a important disease, a metabolic disease in cattle named post-parturient hemoglobinuria. Thus, the anemia is an important symptom. Another symptom is diarrhea. It is named as peat, scours, and teart. Here there is persistent watery diarrhea with yellow, green, or black color feces. The third symptom is deformities of the bone. The bone become porous, called osteoporosis, and that is due to depression of osteoblastic activity. So the porous bone has a tendency to spontaneous fracture, and there is overgrowth of the epiphyseal cartilage. Important fourth symptom is nervous disorder occur in sheep and lamb. Here there is necrosis and degeneration of central nervous system due to endemic anoxia. An animal manifest symptom neonatal ataxia or anxiotic ataxia. In this, there is a incoordination of movement. And another disease called swayback. Here, the curvature of the spine is affected. The fifth important symptom is pigmentary disorder. Here, there is depigmentation of hairs and wool called achromotrichia. And peculiar finding here, there is alteration of hair color around the eyes, and you will find that animal has worn a spectacle because there is white ring around the eyes. So you feel that animal has worn spectacle. So it is called as spectacle disease in cattle. Sixth important symptom is degeneration of myocardia, and that is due to anemic anoxia. And when there is degeneration of the heart muscles, there is acute heart failure. Animals suddenly fall down, called falling disease in cattle, and there is sudden death. Sixth symptom, infertility. There is delayed stress, abortion, or dead fetus that affect the economic status of the farmer. How to provide diagnosis by symptoms? We have seen seven symptoms. The another is give the copper treatment, and if there is response, there is cure in the animal that suggests that there is copper deficiency. So here response to treatment with copper is also a diagnosis. In the laboratory, there is estimation of copper content in tissue, body fluid, diet, and soil. Here there is decrease in copper content. The blood smear reveals hinge bodies in the RBCs. Estimation of ceruloplasmin in serum is also a confirmatory test. Treatment of copper deficiency: give copper sulfate orally. For those requested to refer standard veterinary medicine or pharmacological book. Copper sulfate may be added to the mirror mixture and give it orally. Parenteral injections of copper glycinate is also a very good treatment. If proper care is taken, then there are 100% chances of recovery in these animals. So this copper sulfate salt is a sure treatment of copper deficiency in animals. Requested to share this video to our veterinarians, and you can see many videos on veterinary medicine and disease on YouTube channel. Just type DRVET Dr. Vet in the search bar. Click the search button. You will get many such videos. Thank you very much for observing this lecture.